Good morning. Sakwamkela kwakhona ke nakule yure yesibini imizuzu selishumi lesibini emva kwentsimbi yesibhozo. Igama lami nguLhoza WamaMfene. Mandithathe ithuba ke ndamkele usomachiza uRhadebe Endlebe enhle zombini. Good morning Somachiza.
Hayi sisiloza kunjani?
Hayi andimhlanga.
Uma ndiyakubona.
Hayi ndinazo nezankwane nepompom nayo yonke into. Kutshintsha le season wethu kodwa ke ilindelekile yona iflu sawuthatha pha ku-silver lab i-nasal spray sifake sibe right namayeza lawa silver lab kaloku uyibhatele la advertisement so ndizawumention otherwise ke khabuyisa abaphulaphuli nababukeli beKeith Radio.
Good morning to you, Sisloza. Thank you for having me. Good morning to the listeners and streamers. Igama lam nguLwanda. Go under the hashtag Ask Lwanda or the tag name. Itoni enters social media.
Handle.
The handle. Social media handle.
Bethuna abantu bangapha.
Ayisanyamezela.
Yes.
So namhlanje sithetha about, there's been a lot about doctors, nabantu ababanjwayo, namabanjwa, yebo.
Yes.
And I thought, hey, you know what? It would be interesting to speak to our listeners around healthcare in the prison or in correctional services. Yeah. So it's just a did you know session today.
Yeah. Benke ndabuza ke nami into bana ndisithi abantu zebaphulaphule sifuna ukuva mhlawumbe abanye bayazi noba igazethiwe into uba kufuneke amabanjwa okanye abantu abangapha kwezitixo yes abavalelweyo abofumana ululeko nalo ilungelo loba babe kanti bazawufumana unyango ngokwezempilo. So sathina ngaloo nto leyo namhlanje mphulaphula okanye wena mntu ubukeleyo phaa Keith Radio Facebook page amabanjwa analo ilungelo ahambe aphele phi na. So Machiza manikele kuwe ngexesha ndisazama ke udownloada the gazette.
Okay. So amabanjwa umuntu ubanjwa and then abekwe in a correctional services facility xana sele banjiwe or a prison.
Yes.
Those facilities will have a clinic pakuzo ngaphakathi. So within their walls, they will have a clinic, there will be a nurse, ophangalapha, a registered professional nurse, and la nurse will provide primary healthcare services. To those abafikayo, primary healthcare services means the most basic services of health. So it is not the same as first aid where you have who is a paramedic that comes and provides first aid in an emergency.
Sure.
Lona is a registered nurse but provides services. So kwa khulumende, primary healthcare services are provided by a nurse, and in the private healthcare space, primary healthcare services are provided by a GP. So xa usiya kwi-GP, lana umuntu athi hayi ndiyakwagqirha. Those are the most basic health services. Ugqirha uphethe laa nto stethoscope esizawuphefumla, uyayibo, unetafile yakhe phaa unentoni, and then provides the most basic services. Anything ezawuba complicated beyond that will need a specialist. So uzakuthumela kugqirha wamathambo, kugqirha wabantwana, kugqirha wamehlo, njalo njalo. And that is then called specialist healthcare. So those are specialist services because those people abakunika la nyango, or the people the doctors that are providing that services is a more specialized healthcare. Specialized in the sense that it only focuses on one thing, so this one will only be a gynecologist. This one will only be a dermatologist and doesn't look at everything anymore. So if you need to understand primary healthcare, tell you understand all of
Okay.
The clinic provides primary healthcare services that are provided for by a nurse. Also, get this, it means that it becomes cheaper for the department to have a nurse providing these services and to have the most basic medicine that is available. So by basic, we mean the most common. It doesn't mean that we are saying it's medication. that is less effective or otherwise. It means it's medication for the most common ailments.
Okay.
There is a doctor that, or called a medical officer, that can go to these facilities, but usually the doctor is not permanent there. Angafika once a week or twice a week, depending on the resources of that province, depending on the resources of that district within that province. So someone maybe in Gauteng might tell you a different story to someone in the Free State, or someone within Alfred Nzo might tell you a different story to someone in OR Tambo district or in Buffalo City district, depending. At Omnyonotina, we have a pharmacist. At Omnyonotina, we don't have a pharmacist. We only have the nurse. But yes, more or less, that's what it is. We have medication that is available by this pharmacist. The pharmacist gives to the nurses. The nurses consult the patients and dispense the medication. If something is complicated, that patient will be referred to a doctor. The doctor will provide the services. Should the ailment be even more complicated, the doctor will then refer that patient to a hospital. So, uqala kwami ke ukuphangela ndasebenza in a tertiary hospital apha eMonti. Now we would have ke amabanjwa afikayo pha. We would have prisoners that come and they are escorted by staff, such as correctional services. All throughout, as this person is consulting the doctor, as this person goes to the pharmacy.
Bendizabuza loo nto ngoba aba bantu nina as pharmacist uqeqeshiwe wena njengosomachiza nonesi ungusista onamagxa amaroon, and now ngoku unxibe uniform ekaki engekho mhlophe anymore with amagxa. Akayiqeqeshelwanga yonke le nto, and ufumanise uba ngenye ixesha uzawuzibona umntu sele echaphazeleka ngoba amanye amabanjwa mhlawumbi ke abandlongondlongo nokuyoyika. Is there a form of just a basic I don't know, training just to understand mhlawumbi into yobana ngoku awukho phaa ekliniki ephanga phandle, kwikliniki yamabanjwa ikhona into enjalo?
No, Sis Lhoza, there's no training. Ibanjwa eli is restricted, so akafiki pha esibhedlele ehamba like a normal person. They have handcuffs apha ezandleni, and then pha ezinyaweni afakwa namachain. Yes. But I found that this was not with all the prisoners. I think some of them gain some kind of benefit because they had been in prison for a while, or because of good behavior or something. I found that some of them were not as heavily restricted, and some were heavily restricted. But I don't know what would have been the difference. Is it because Omnia is there for a lighter crime or has a lighter sentence, and Omnia is there for a heavier crime, something like murder, or so ours was just to receive the patient's folder, dispense the medication, and we would dispense it, giving it to the correctional services staff, explain to them how the patient is supposed to take the medication. And that patient would then have to go and wait in. So if we are fika nje in the waiting area, simnceda ngoko nangoko. Asifuni uba makahlale phayana.
Ancokole nathi apha etyhwini sibe sitshitshiliza sonke uba phaa ngaphakathi incoko ibe ngathi they are not allowed. But ena nto ingamandla mhlawumbi esifuna uyiveza into yobana igazethiwe kwango-1998, Correctional Services Act of 1998, that the department lejongene nabo must always, within its available resources, as Buzulanda said, Chilo, provide adequate healthcare services based on the principles of primary healthcare, in order to allow every prisoner to lead a healthy life. Every prisoner has a right to adequate medical treatment, but no prisoner is entitled to cosmetic medical treatment at state expense. So this is just and medical treatment must be provided by a medical officer, medical practitioner, or by a specialist or healthcare institution or person or institution identified by such medical officer, except where medical treatment is provided by a medical practitioner in terms of section 3. Ikhona pha kwigazette into esifuna iveza into yobana amabanjwa they should undergo medical treatment necessary for the maintenance and recovery of impilo yabo. So uba bahlabene pha ngaphakathi okanye kukho loo nto kufuneke ehoyiwe immediately, funeke ethungiwe, funeke enziwe yonke laa nto ubuzayifumana nawe, qha ke umahluko mhlawumbi ke nyhani ke mahala.
Yes.
Njengawo uba nawo uzafumana mahala apha ekliniki ngaphandle.
Everyone, i-primary healthcare in South Africa ayibhatalelwa. You may start paying when you go to hospital, right? Now, uza kule ndawo ke ngoku ithi we are equal, but some people are more equal than others. Kukho umuntu osejele but has money, even though it's a jail, right? And this person might say that, you know, I have to undergo a certain procedure. The public hospital, the nearest public hospital, does not provide for this service. So, ndifuna ukuya to a private hospital.
Yes.
And this is allowed, right? But there is a head of the institution of that prison that will have to take that application, ayithumele to a area manager, correctional services, and the area manager will then send it to a regional commissioner. So we have a national commissioner, Losmazio, Nalamwa.
Yeah. Yes.
And then there are regional commissioners within provinces that will have to approve that, okay, no, Mr. So-and-so or Miss So-and-so or Umdana, if Umdana, can go to a private facility. But now that person needs to be transported to that private facility. And it might be an operation and they end up staying there for weeks. They need to have security personnel guarding that person. So the department sort of has an invoice now for that person to say, okay, this is how much we will charge you to transport you to this hospital. This is how much we will charge you so that we are guarding you there, you know. But if it's a government clinic, the patient doesn't pay. If it's
but landa kaloku uba ngaba bendizawuza ndibanjwe eWest Bank, ndifukeze umzekelo ngam, umuntu ubanjwile ibanjwe lise-West Bank currently and linemali elibanjwa, le mali yayo inde alifuni ukutreatwa by the institution okanye phangaphakathi okanye lithunyelwe apha kwisibhedlele sikufutshane which is ifre, ufuna yena ukuya kwi-private hospital elapha unemali. Uba bebezawuswe efre ebengazugadwa, but because ndinemali ndizazibhatalela isibhedlele but ndigadeni ngalaa ndlela bendizandigada ngayo free efre. Ayihambi njani?
Ayisebenzi ngolo hlobo. So you have to pay for everything. You have to pay to be transported to the private hospital. You have to pay for the security personnel that will guard you at the private hospital. And also, it's not just the money thing, right? It's not a matter of you can refuse treatment for any and everything and say, no, I don't want to be treated here. I want to be treated at the private hospital. It is in special circumstances where maybe we can prove that, okay, if the service will only be available in 3 months' time.
Okay.
But then if you went private, you can access the service more immediately.
Okay. All right. Mhlawumbi awambihambi yena sekutyeni uba besithetha ngezinye izinto uba andifuna uyitya ke le mna nayo imali yam zazithenge lapha ngaphakathi mandiprovayidwe ngohlobo, but ke that's not what we are talking about today. Namhlanje sithetha okanye sisazisa umphulaphula into yobana umntu obanjiweyo unalo ilungelo lokufumana unyango lwezempilo njengawo wena uphina ummi weli loMzantsi Afrika apha kwilizwe ephanga phakathi, so unalo ilungelo lokufumana unyango nololuba loluphi uhlobo ngaphandle kolu ke lunganyanzelekanga, the cosmetic one. Kodwa oluphina unyango kukho oogqirha, kukho abakhoyo, kukho nesi o-full time ongena eshifting abanxiba nazo impahla ezifana neze-wardens and into kuyo umahluko into yobana banamagxa bona. So there's a clinic ekhoyo up, and I know first hand ke because malume wami besebenza pha ngaphakathi engunesi wabo, and the trauma and everything. Retire ephaya for almost inantsika yakhe besebenza phaya, and bayaba akho kuthiwa boma yageza lo muntu lona, kodwa funeka umnyangile noba ungathi kuthini. So I abantu kukuinforma nje ubutshilo uba bayazi uba banawo amalungelo njalo 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 njalo. Did you know ukuba ibanjwa linalo ilungelo? Ncokola noSomachiza #AskLwanda besamanje ukwazisa into yobana ahamba phele phi na, so singacingi fana uba mhlawumbi bona abanalungelo lozonyango, banalo. Somachiza, siyabulela.
All right, enkosi Sislotha.
Sibamba ngazo zozibini Somachiza.
Ndiyabulela, thank you. That's all for today.
Yeah, that's all. Did you know uba ibanjwa nalo ilungelo na lonyango lwezempilo? Until next Wednesday. Somachiza Lwanda kamkhatshana ngamlandela #AskLwanda besincokola naye ke namhlanje. Masimkhuphe ke ngengoma eza kulandela emva koku.